at 8. Chicago's Morning Answer with Dan and Amy continues next on AM 560, The Answer.
Listen to AM 560, The Answer, online at 560theanswer.com, on the AM 560 mobile app, on your Alexa-powered smart speaker, on TuneIn, iHeart, and radio.com. Let freedom ring this afternoon at 2 with Sean Hannity on AM 560, The Answer.
Top of the morning, Dan and Amy. Well, shutdown artist, Michigan Governor Gretchen Whitmer got shut down by the state Supreme Court.
She sure did. Friday was a good day.
In a Friday opinion, the Michigan Supreme Court, quoting Montesquieu, when the legislative and executive powers are united in the same person or in the same body of magistrates, there can be no liberty. And that's exactly what she did, operating under the state's Emergency Management Act, which allows the governor to declare disaster, but for only 28 days until and unless a longer period is approved by the legislature. Republicans in Michigan were in no mood to approve that. And the shall issue a declaration if the governor finds an emergency has occurred. The court explained that she had no choice here but to, the argument that she made to the court, explaining that she had no choice but to redeclare a state of emergency. But Michigan Supreme Court Justice, writing for a unanimous court on this point, to allow such a redeclaration would effectively render the 28-day limitation a nullity. In other words, you can't just forever re-up without enlisting the legislature and saying, well, I'm just doing it 28 days at a time, so that's consistent with the law that allows me to only do it for 28 days without legislative approval. That clearly would nullify the law. So
why can't we do this here in Illinois?
So there's other states that are in a similar situation with similarly inclined governors that may be using this as a model to seek redress from the courts as well. We'll see. And then there's this piece from three academics in National Review, nationalreview.com, a microbiologist and a couple of statisticians, looking at the stats now that we have a great body of statistics to review. Stats hold a surprise. Lockdowns may have had little effect on COVID-19 spread. To judge from the evidence, the answer is clear, they write. Mandated lockdowns had little effect on the spread of the coronavirus. The charts below in this piece, which I'll tweet out at Dan Proft, show the daily case curves for the United States as a whole and for 13 U.S. states. As in almost every country, we consistently see a steep climb as the virus spreads, followed by a transition to a flatter curve. At some point, the curves always slope downward, though it wasn't obvious for all states until the summer. The lockdowns can't be the cause of these transitions. In the first place, the transition happened even in places without lockdown orders, see Iowa and Arkansas, for example. And where there were lockdowns, the transitions tended to occur well before the lockdowns could have had any serious effect. The only possible exceptions, California, which on March 19th became the first state to officially lock down, and Connecticut 4 days later. And they have the data to back up that summary. Oh, by the way, just comparing and contrasting, consistent with both of these articles, Michigan and Sweden have roughly the same population.
Yeah, 10 million.
Michigan had draconian Whitmer-style lockdown orders. Remember,
They're the worst. You couldn't even go see your family at Easter time.
You couldn't buy seeds for your garden, but you could buy lottery tickets and so on and so forth. And Sweden, as we know, we've discussed, everybody's discussed, very light touch, no lockdown orders, no mask requirements. Same size population. Sweden has 20% fewer deaths than Michigan. Interesting. For more on all this, we're pleased to be joined by Dr. Roger Klein, expert with the Regulatory Transparency Project's FDA and Health Working Group, former director of molecular oncology at the Cleveland Clinic, and former advisor to the full alphabet soup of federal public health agencies, FDA, CDC, CMS, and HHS. Dr. Klein, thanks for joining us again. Appreciate it.
Yeah, hi, Dan. Hi, Ian.
Hello. So what about that? Before we get into the particulars of the Trump case and all the politics surrounding that, just what about the evidence that's in so far as to whether lockdown policies had a marginally beneficial effect as compared to non-lockdown policies?
Yeah, so I think this has been evident to people who have been following the data. I mean, I haven't done a rigorous analysis. I've been following it and watching it. We've talked about it before. I'm not, obviously others have done the same. And there doesn't seem to be a correlation between the imposition of lockdowns and how well states perform. In fact, those states that were most stringent in their restrictions have both the most or highest numbers of deaths per million, and they have much higher unemployment. So I think as a policy matter, those are lockdowns seem to be an ill-conceived policy.
Harvard medical professor Martin Kulldorff joined me last week, and thinking about what we should be doing going forward, he basically said Florida is what we should be doing going forward. Listen to him. I'm going to get your reaction.
Yeah, I think Florida is taking the right approach, which is to open the society for open all the schools for in-person teaching and universities, and opening restaurants and so for the majority of the population. At the same time, increasing the efforts to protect the elderly and asking older people should not go out and mingle in restaurants because they are at high risk. And once we have reached herd immunity, whenever that happens, either through a vaccine or natural infection, or most likely maybe a combining of the two, then older people can also start living normally.
So Kulldorff also one caveat there saying, teachers over the age of 60, whether in K through 12 or college, should be not in the classroom. That's one precautionary measure that should be taken. But otherwise, you heard what he said.
Yeah, I agree with that. We've been saying that all along. I think we need to learn to live with the virus. It's called a pandemic. It's called an epidemic because we don't have an ability to contain it, and life can't stop. What we can do is protect vulnerable people. I think that's clear, particularly in institutionalized settings like nursing homes, where we have control over who comes in, who comes out, and we have new, rapid, exciting testing that can detect outbreaks early and put an end to them by separating people.
Well, I have rapid testing in the White House, and that didn't seem to help in this situation with President Trump, Melania, and others getting COVID.
Yeah, you're right. It appears not to have helped. On the other hand, we don't quite understand the epidemiology of it, and yes, people got caught right away. We don't in a nursing home. For example, if you restrict testing, or if you restrict infections to 5 people or 6 people, that's pretty good. That the problem is if everybody gets it, a quarter of them will probably die. So I think we need to. How many people have actually tested positive? How many people are positive who are in the president's circle? Not that many, based upon the size of the circle. And I think and part of that is because they've been able to test people right away and then isolate.
Tyler Cohen made this point over at Marginal Revolution about the treatment for President Trump. Regeneron's chief executive, Dr. Leonard Schleifer, said on Friday that Trump's medical staff reached out to the company for permission to use their monoclonal antibody as part of a treatment, and that it was cleared for emergency use through the FDA for compassionate use. Cohen says there's such cacophony when Trump pushes the FDA to speed vaccine approval, yet when he actually gets a promising treatment through the process prematurely, only for himself, not a single person is yelping, not even his worst enemies and his most vicious opponents. Should he be pushing for FDA green lighting monoclonal antibodies as a treatment?
What he should be doing is pushing for the patient's right to try, which is what he's doing. So, and he implemented right to try. In other words, patients can have access to promising drugs early if the company's willing to do so, and that was something that the president pushed through. I think he should. Regulators strike a balance, and they're looking at safety and they're looking at efficacy. And in emergency uses, you don't have to have full proof of safety and efficacy. What you want to have is a balance, and the law says they may be effective, and you balance the risks and the benefits. And what he should be doing, because where the policy decision comes in, is where do you fall on that basis of risks and benefits? Remember, when you give an emergency use authorization, you don't have forcing people to take something. It's their choice with their physician, and I think he's right to try to nudge the policy direction in a direction of greater liberality. These are fine. These are kind of nuances. They're not absolutes. But regulators tend to be very cautious and conservative, and one of the reasons that the political branches control the regulatory agencies is to make them responsive to public demand.
These artificial and these artificial antibodies, though, I mean, just in terms of the therapeutics that are out there, as people are trying to understand what's happening, hydroxychloroquine, remdesivir, dexamethasone, these artificial antibodies from Regeneron, for example, Professor Peter Horby at Oxford said, look, they've been around for quite a while. They've been extensively used in inflammatory conditions and cancers. They're pretty safe and well understood. So the technology is something that I think we have confidence in. So why wouldn't it be available to people not named Trump?
Well, I think it is. I mean, if the company's willing to do it, but I can't sit from here and judge FDA's response. They looked at 275 people with this medicine. They appear to have, particularly in people who don't mount an immune response, which presumably are those who appear to do worse, and maybe would implicate some of those people who have bad outcomes. It appeared to shorten the length of symptoms substantially in those patients who didn't have antibodies, and it looks like it brings down the amount of virus in the blood substantially in these 275 people. Now, without looking at the data in a more granular way, it's difficult to make a comment, but I think my preference is to err on the side of safety. So when we see something that looks like it's not harming people, and we've tried it in enough people, we look at the balance of considerations as to whether or not a certain population group, particularly those who are at high risk, should be allowed to get these drugs. I think overregulation can kill people the same way underregulation can.
Do you think President Trump's doctors have prescribed the right treatment for him so far?
Well, he seems to be doing well. Look, I can't second guess these physicians from Hopkins and from Walter Reed. What they're doing is they're aggressive in the way they're treating him, in the sense that some of the approaches, remdesivir and steroids, have been typically given. The studies have been run on patients who are sicker than the president. Does that mean that you shouldn't be more aggressive with the president of the United States? Absolutely not. And I would never second guess these people who obviously know what they're doing and are quite smart. The president's doing great, and I think these questions you're asking are wonderful, because what they do is they put the focus on how our regulatory system ought to function.
Yeah, absolutely. How would you assess the communication, the public communication? I know this is, not exactly their forte. This is not, they're medical professionals. They're not PR people. But when you have a high-profile client in this context, like the President of the United States, being transparent in communicating his condition is an important piece of it, to the extent that he's not communicating himself. And do you think that the medical team for President Trump has been effective in terms of communicating to the public?
Yeah, I mean, I think, again, this is an area where the media they're watching second to second. And I got to tell you, it's really, it's so harmful. These are doctors. They're not media spokespeople. They're not used to doing this. And they've got a patient who's high profile. Normally, as a physician, you can't say a word about a patient. There are laws against it. And so you're putting people out in front, and they have to be extremely cautious, and they're not used to doing it. I think they're doing a great job. The president himself has come out, and he's tweeting, and he's putting out videos, and we're getting the information that the patient wants to provide. The doctors are doing a great job. I mean, this isn't their job to be communicating with the media. I think.
Yeah, no, I get it. And how do you react to the argument that Trump being infected specifically is science combined with karma, because he was reckless? That's the only way he could have gotten it. It's reckless for doing these campaign events and for not wearing masks as often as some people say he should, and so forth?
I think it's horrible to say that. It's wrong. First of all, he has extensive testing protocols in place. What it suggests and what everybody should understand is what CDC said in early March. Most people are going to get it. You have to understand it's a very contagious respiratory virus. There's little we can do about it. We can't sit and stop life. It isn't going to go away that way. Masks aren't going to do anything. This is a at least let's put it this way: we don't have data that masks are going to stop the spread of this virus, and there is no reason to believe at all that it could stop this epidemic. It's called an epidemic. It's called a pandemic because we can't contain it. And I think the president did the right thing in terms of going out and campaigning. People make choices. If you want to go into a crowd, you're risking getting infected. Most people will not get sick from this disease. Most people will not suffer serious consequences. However, some will, and particularly if you're at high risk. And I would urge those who are at high risk to stay away. The president made a choice. It was his choice to make. I do not believe we don't know how he got it, but I don't think, when I said masks won't do anything, I'm particularly talking about in his ambit where everybody around him is tested. It's kind of hard you can't live your entire life with a mask on. So I think, I think that, we don't have data again that it would do anything, that would really stop the spread. I think what this should do and what people should take away from this is this is a highly contagious virus, that even with all the precautions and all the testing and everything that the president has been doing, they could not shield him from it. Mm-hmm. It's an important lesson because people need to understand that these lockdowns and these extreme measures that go ahead and they destroy people's economic lives, they really aren't, in the end, they're not going to work. And what will potentially save lives and stop this epidemic, first of all, is, as we said earlier, protecting people in nursing homes, and second is a vaccine. And this Regeneron drug, which operates through antibodies to the spike protein, 2 different antibodies, this study provides support for the idea that a vaccine could be helpful. The vaccine's directed toward that same spike protein.
He is Dr. Roger Klein, expert with the Regulatory Transparency Project's FDA and Health Working Group, former director of molecular oncology at the Cleveland Clinic, former advisor to the FDA, CDC, CMS, and HHS. Dr. Klein, thanks again for joining us.
Thank you.
Thanks. And he joined us on our turnkey.pro answer line.
Before you see it on TV, share it on Facebook.